This is the Pick Your Poison podcast. I'm your host, Dr. JP, and I'm here to share my passion for poisons in this interactive show. Will our patients survive this podcast? It's up to you and the choices you make. Our episode today is called Hitchhiker. Want to know what hitchhikers have to do with toxicology? Exposure to what animal has been mistaken for a drug of abuse? And what substance costs $40 million per gallon? Listen to find out. Today's episode starts with a phone call. Your friend's name pops up on the screen and you answer, expecting to hear about her weekend trip to an expensive spa. Except she's crying so hard you can barely understand what she's saying. You manage to gather she's on the way to the emergency department but can't understand anything else. You tell her you'll meet her there. You rush inside, relieved she's already in a room and under the care of a colleague. You sit in the bedside chair for relatives, which feels kind of weird. Your friend's face is streaked with tears and she's curled up in a fetal position on the stretcher, but at least she's no longer crying thanks to a dose of pain medicine. She's 33 years old and an otherwise healthy marathon runner. What has happened? She says the spa in Arizona was amazing. She got facials, massages, did sunrise yoga, hiked, ate delicious meals, and arrived home late last night on an uneventful flight back to New York City. The symptoms started with pain in her hand associated with numbness and tingling moving up her arm. It became excruciating and now involves her whole body. Her lips feel numb, she's shivering, and you can see her muscles shaking. The monitor shows her vital signs, temperature of 98.5 or 36.9 Celsius, blood pressure mildly elevated at 150/70, heart rate 120 beats per minute, respiratory rate 20, pulse ox 100% saturation on room air. As you sit there every 5 or 10 minutes, she has more severe spasms resembling a seizure, though unlike a seizure, she's awake and talking during the episodes. Was she poisoned at this spa in Arizona by the healthy food? I know we have some crime writers listening, and I'm sure they've already generated several potential plot points. Was there mercury or heavy metals in the facial? Did she drink essential oils instead of smelling them? A delayed onset snake bite from the hike? Lighthearted joking aside, something serious happened. You've only been there for 30 minutes and her condition is worsening. She's no longer looking at you or anything else in particular. Instead, her eyes are roving back and forth, continuously like she's watching a very disorganized tennis match. Uh-oh, this is called opsoclonus. What causes this? Well, first, it's not a vision problem, but a sign of neurological problems in the brain, essentially representing disorganized brain circuits, which is about as bad as it sounds. It can be a paraneoplastic syndrome, meaning associated with an underlying tumor. It's also caused by severe autoimmune disease like lupus cerebritis, i.e. brain inflammation, and infection like encephalitis from West Nile virus, for example. Yikes, this is not a list anyone wants to hear. A mercury-infused facial might be better, and it's definitely not a list you want to think about for a friend. Does she have one of these? Opsoclonus is associated with advanced disease in all of the above cases. None of it cause it in the span of a few hours. This suggests, you guessed it, a toxin. Question number 1. We're starting off with a tough question today. What toxins cause opsoclonus, those roving eye movements? A. Lithium. B. Serotonin, i.e. serotonin syndrome. C. Scorpion envenomation. D. Cocaine. E. All of the above. The answer is E. All of the above. Nobody hopes to be poisoned, but if I ever develop opsoclonus, I hope it's from a toxin. Why? The toxins are generally treatable and reversible, unlike some of the severe neurological causes. But what happened to your friend? Looking at this list, she doesn't do drugs and doesn't take any medicines, ruling out lithium, cocaine, and serotonin syndrome caused by medicines like antidepressants. She was just in Arizona, home to scorpions. Opsoclonus is especially associated with bark scorpions, which are native to Arizona. And her other symptoms, pain and muscle spasms, are classic for scorpion envenomation. Wait a minute, did I hear you say? She said she was fine until she got back to New York City. Excellent point. Can you have delayed onset symptoms? I mentioned snake bites a minute ago, rattlesnakes and other pit viper envenomation. The symptoms start pretty much immediately, and at the worst, they develop over a few hours. In contrast, elapid bites can have delayed symptoms up to 12 hours. In the U.S., these are coral snakes causing neurological symptoms like weakness and paralysis. In other places, it's cobras and mambas. Can scorpion stings also cause delayed onset symptoms? No, so should we rule it out? Well, I just said her symptoms are classic, and this brings us to a rare but famous issue in toxicology: hitchhikers and stowaways. Not the serial killing kind, but the venomous kind. Scorpions like cool, dark places, suitcases, for example. Patients have returned home uneventfully, then been stung after unpacking the suitcase where the scorpion unintentionally stowed away. So even if you work in a big city like New York or a cold place like Canada, you might get a call about an envenomation from a non-native animal. Could be someone's exotic pet, but it might be a stowaway from their vacation. Dry cleaners have been stung by creatures hiding in the laundry pile. And it's not just scorpions, but snakes and spiders too can also travel. Your friend was fine until she decided to unpack her suitcase a few hours ago. When she reached in, the hitchhiker scorpion stung her. She had the presence of mind to slam the suitcase shut and zip it so there isn't a rogue arthropod roaming her house or her neighborhood, but she didn't stop to identify it. It's okay because based on her symptoms and the spa's location, you can guess it was an Arizona bark scorpion or a Centroides exsilicata. Confirming your suspicion, she has a single puncture wound on her arm with mild redness and swelling. You tap the wound. Some envenomations can cause a positive tap test. That's question number 2. What do you expect if this is a scorpion sting? A, bruising when the skin is tapped. B, increased reflexes when the skin is tapped. Or C, increased pain. The answer is C. The tap test is when pain and tingling increase over the area when tapped. It isn't true for all scorpion stings and it doesn't work in every case, but if it's positive, it certainly suggests a scorpion. She shrieks when you tap it, so it's definitely positive. Are you asking why we need a test to figure out if somebody is envenomated? Shouldn't it be obvious? Well, good question, but in reality, the history might be lacking more often than you think. If it's dark, the victim might not see what stung them. Scorpion wounds are very small and they're not always visible to the naked eye. And with children, it can be particularly difficult. If they aren't able to talk and if an adult doesn't see what happened, then it can really be a medical mystery. Question number 3. Your friend needs an antidote. A, true? B, false. The answer is A, true. There is an antidote for Centroides scorpion stings called Anascorp. It's made in Mexico from 4 different types of Centroides venom, and it's an antibody fragment like snake and digoxin antivenom, which we've talked about before. So who should get the antivenom? Well, it depends on the severity of the symptoms. We use a grading scale with numbers from 1 through 4, and it's typically administered to patients with a scale of 3 or 4. Grade 1 is local symptoms with mild pain at the site of the sting. Grade 2 is pain moving up the extremity. It can include perioral numbness around the mouth. For both of these categories, pain medicine is usually sufficient and antivenom is unnecessary. Grade 3 is systemic symptoms, either neuromuscular changes like whole body pain, restlessness, myoclonus, i.e. muscle twitches and jerking that can be mistaken for a seizure, or cranial nerve symptoms like opsoclonus, hypersalivation, speech problems, and tongue fasciculations. Grade 4 is both cranial nerve dysfunction and neuromuscular changes. How does scorpion venom work? Like snakes, it's a combination of toxins. In this case, it's most notably neurotoxins. We still have a lot to learn about exactly how the venom works. In bark scorpions, it's thought venom opens sodium channels in the neuromuscular junction, causing repetitive depolarization, meaning release of excessive amounts of neurotransmitters like acetylcholine, epinephrine, and norepinephrine. Lots of complications can occur. We can't get into them all here. It would take all day because different species around the world cause different symptoms. But I do want to mention some less common effects. Autonomic storm is one. That's a high heart rate and blood pressure from release of epinephrine and norepi. It's essentially a fight or flight response from the envenomation rather than the circumstances. Quite frankly, if I'm ever up close and personal with a scorpion, I'm going to experience an autonomic storm just from looking at it. There are reports of myocarditis, inflammation of the heart muscle, arrhythmias, and even heart attacks. Coagulation problems, i.e. bleeding disorders, hemoptysis, coughing up blood, ARDS, acute respiratory distress syndrome, and pulmonary edema. Strokes can happen even in children, and seizures. One complication is a very classic board question, and that's question number 4. Scorpion envenomation is often associated with A, pancreatitis, B, encephalitis, C, diabetes, or D, wound necrosis. The answer is B, pancreatitis. I've known the answer to this question since medical school, but I didn't know until this podcast that it's not actually associated with American scorpions, but mainly scorpions found in South America. Centroides scorpions are rarely fatal to adults. The symptoms typically last for 6 to 30 hours, then resolve even without antivenom. Most deaths occur in children under 2. Why? That's question number 5. A, pediatric immune systems can't fight off the effects of the venom. B, the delay in diagnosis that can occur. Or C, the venom dose. The The answer is C. It's related to the relative dose of venom. The sting delivers a certain amount of venom, and you can imagine in a small child, the relative dose compared to their size is much, much larger than in a full-size adult. Therefore, they suffer the effects much more acutely, especially when they're under 2. One study found that grade 4 envenomations occurred in 16% of patients younger than 10, but in less than 1% than those older than 10. The same principle is true even with the death stalker scorpion found in the Middle East and North Africa. It's the scorpion with the most dangerous reputation worldwide, but the principles of treatment and the symptoms are similar to Centroides envenomation. It is more likely to be lethal in children, and there is a very effective antivenom. Interestingly, scorpions can control the amount of venom they inject, and this is called venom metering. When scared by a human, the scorpion can choose to inject half the amount of venom they would when attacking a prey. And this might account for the fact that the vast majority, at least 95% of envenomations worldwide, result only in local manifestations. So back to your friend. She has systemic symptoms, grade 4, and meets the criteria for antivenom administration. Except this hospital is in New York City and it doesn't have any antivenom. What now? You call the poison center, and fortunately, they have some Anascorp and they send it to you. The recommended dose is 3 vials in both children and adults, again, related to the dose of the venom rather than the size of the patient. What if the poison center didn't have it? The treatment would be pain medicine, opioids, and benzodiazepines for the muscle spasms. In addition to their other effects, like sedation and anxiolysis, benzos are muscle relaxers, so they can be quite useful. United States poison centers get about 20,000 calls per year regarding scorpion exposures. Most, not surprisingly, are in Arizona. But this is an extremely low number compared to other places. One study over a 5-year period in Saudi Arabia found 72,000 reported exposures, and you can imagine that most are never even reported. Worldwide, it's estimated that there are 1.5 million exposures causing about 2,000 to 3,000 deaths per year. As with snakes, different antivenoms exist for different species. Anascorp, the Centroides antivenom, is an amazing antidote. It works quickly, it binds to the venom and inactivates it, and in fact, most symptoms resolve within 1 to 2 hours. In the United States, between 1930 and 1940, there were 40 deaths from scorpions, mostly in infants and children, but there's only been 1 death reported since 1970, and this was thought due to anaphylaxis rather than true envenomation, thanks to modern medical care and antivenom. Question number 6. What drug of abuse has been confused clinically for scorpion envenomation in small children? A. Methamphetamine, B. Fentanyl, C. Cocaine, D. MDMA, which is ecstasy or Molly. The answer is A. Methamphetamine. I'm sorry to report that in the United States, pediatric patients poisoned with meth have been confused for victims of scorpion envenomation. Both types of exposure cause tachycardia, high blood pressure, agitation, and inconsolable crying. Both cause catecholamine release, epinephrine and norepinephrine, and in the U.S., there's an overlap in geographical regions of scorpion habitats and human meth use. Scorpions are cool prehistoric animals. There's evidence they existed at least 435 million years ago, and it doesn't seem like they've changed much since. Ancient Egyptians believed scorpions were created by decomposing corpses, crocodiles, and lizards. Interestingly enough, they've been used in warfare. Greeks defending a city from a besieging Roman emperor named Septimus Severus hurled bombs filled with scorpions down on the army, leading to its retreat and the Greek victory. Even in more modern times, the Viet Cong placed scorpion traps in underground tunnels to envenomate American GIs. As with, as far as I can tell, every other toxin known to man, scorpion venom has, of course, been used as medicine. In ancient China, it was used to treat seizures and spasms. It's been used for malaria and arthritis. And even today, blue scorpion venom is touted as a treatment for cancer, despite the fact it's proven not to work like so many alternative cancer treatments. Not surprisingly, patients undergoing alternative treatments for cancer have a higher mortality rate than those taking traditional medicine and chemo. There's a really cool development under investigation showing some real promise for the medicinal use of venom. There's something called BLZ-100, which is made from chlorotoxin. That's a peptide derived from scorpion venom, and it's being used to quote-unquote paint cancer cells. A cool fact about scorpions is that they're fluorescent under black lights. Sometimes campers will use this to make sure there's no scorpion in their sleeping bag, for example. But anyway, this molecule has been injected into humans to light up cancer cells during surgery so that surgeons can see these cells and remove them. It's pretty cool. You can see 200 cells lit up with BLZ-100 versus an MRI machine, which requires 500,000 cells to be able to see a lesion. It's pretty amazing, and time will tell if it's going to be an effective tool to treat cancer or not. How do you obtain scorpion venom for research? This is an interesting topic in and of itself. The venom is considered one of the most valuable substances in the world, reportedly worth $10 million per liter or $40 million per gallon. These numbers prompted a crazy speculation market a few years ago. People thought raising and milking scorpions could yield a massive profit. Unfortunately, it didn't quite work out that way, and it resulted in a lot of money loss and bankruptcy. Why? Researchers do use venom in the lab, and they pay a lot of money to purchase it. However, they usually only buy a few milligrams at a time, not gallons or liters. Additionally, it needs to come from a reputable source. Researchers say they're often contacted by people who want to sell them venom, but it's often unclear which species the venom is from. The species are mixed together, and the samples are unpurified, making it worthless for research purposes. I love this quote from Nathaniel Frank, who's an owner of a lab in Wisconsin and a supplier of research-grade venom. Quote, "If it was the most expensive liquid in the world, I'd be driving a Ferrari and not an old Ford truck." End quote. All right, back to your friend. An hour and a half after receiving the antidote, she is dramatically improved and requesting discharge. She asks what to do with the scorpion in her suitcase, a question you have no idea how to answer. This is a fictional case, as are all our cases, to protect the innocent, but it is based on real poisonings that have occurred. The last question in today's podcast. A debate published in 1887 in The Lancet attempted to answer the following question. Do scorpions in a fire sting themselves to death to commit suicide? A, true. B, false. Follow the Twitter and Instagram feeds, both at PickPoison1 for the answer. Remember, never try anything on this podcast at home or anywhere else. Thanks so much for listening. It helps if you subscribe, leave reviews, and/or tell your friends. Transcripts are available at pickpoison.com. While I'm a real doctor, this podcast is fictional, meant for entertainment and educational purposes, not medical advice. If you have a medical problem, please see your primary care practitioner. Thank you. Until next time, take care and stay safe.